Hello, welcome to the School of Medicines. Today we will discuss the complete pharmacology of aspirin. Aspirin, also known as acetylsalicylic acid, is a widely used medication with several pharmacological properties. Now, how it works in the body, the mechanism of action. Aspirin works primarily by inhibiting the enzyme cyclooxygenase, or COX, which exists in two main forms, COX-1 and COX-2. This inhibition leads to decreased synthesis of prostaglandins and thromboxanes. The prostaglandins mediate inflammation, pain, and fever, while the thromboxane A2 promotes platelet aggregation and vasoconstriction. By inhibiting these pathways, aspirin exerts its anti-inflammatory, analgesic, antipyretic, and antiplatelet effects. Now, Pharmacokinetics of aspirin. 1. Absorption. Rapidly absorbed from the stomach and upper small intestine. Peak plasma concentrations are reached within 1 to 2 hours. Now, 2. Distribution. Widely distributed in tissues and fluids, with significant binding to plasma proteins, especially albumin. Now 3. Metabolism. Metabolized primarily in the liver to salicylic acid, which is further metabolized to various metabolites. 4. Excretion. Excreted mainly by the kidneys, both as free salicylic acid and its metabolites. The excretion rate increases in alkaline urine. Next. Therapeutic uses? Well, let's dive into that. First, anti-inflammatory. It's used in the treatment of inflammatory conditions such as rheumatoid arthritis and osteoarthritis. Second, analgesic. It's effective for mild to moderate pain relief, including headaches, muscle aches, and dental pain. Third, antipyretic. It reduces fever by acting on the hypothalamus to dissipate heat. Lastly, antiplatelet low-dose aspirin is used to prevent blood clots, thereby reducing the risk of myocardial infarction, stroke, and other cardiovascular events. The next is adverse effects. Yes, it has different side effects on different organs. A. Gastrointestinal gastric irritation, ulcers, and bleeding due to COX-1 inhibition, which protects the stomach lining. B. Bleeding. Increased risk of bleeding due to the antiplatelet effect. C. Allergic reactions. It can cause hypersensitivity reactions including asthma exacerbation in susceptible individuals. D. Raynaud's syndrome, a rare but serious condition that can occur in children with viral infections who take aspirin. E. Renal impairment. High doses can lead to reduced kidney function, especially in patients with pre-existing kidney conditions. Next one is contraindications. Let's go through them. A. Peptic ulcer disease. B. Hemorrhagic disorders. C. Hypersensitivity to NSAIDs. D. Children and teenagers with viral infections, due to the risk of Raynaud's syndrome. E. Severe renal or hepatic impairment. Next is drug interactions. Aspirin exhibits different drug interactions. Some important drug interactions are here discussed. Anticoagulants, increased risk of bleeding. Other NSAIDs, increased risk of gastrointestinal side effects. Antihypertensives, reduced effectiveness due to retention of sodium and water. Methotrexate, increased toxicity due to decreased renal clearance. Now, what is the dosage and administration? Dosage and administration. When used as an anti-inflammatory, analgesic, or antipyretic, typically, the dose is 325 to 650 milligrams every 4 to 6 hours as needed. For antiplatelet use, commonly 81 milligrams, also known as low-dose aspirin, once daily. Monitoring. Regular monitoring of renal and hepatic function, especially in long-term use. Monitoring for signs of gastrointestinal bleeding. Regular blood pressure checks due to potential interactions with antihypertensive medications. Special populations. Elderly, increased risk of adverse effects, may require dose adjustment. Pregnancy, generally avoided, especially in the third trimester due to the risk of fetal complications. Lactation. Use with caution. Aspirin can be excreted in breast milk. Aspirin remains a cornerstone in the management of various conditions due to its multiple pharmacological actions. Its use must be carefully considered and monitored to balance therapeutic benefits against potential risks. Thanks for watching. Press the bell icon to stay updated.